Alright, so this video is pretty much going to be a chronicle of my brain tumor journey, if you will, dating back from 2007 until today, which is August 15th, 2012. So it'll be about my whole brain cancer, brain tumor journey. So starting back, I was first diagnosed with a brain tumor on what I like to remember as September 27th, 2007. I was in 7th grade, and the reason for the diagnosis was that I had been experiencing tingling and numbness in both of my arms and legs, and as well as chest pain and some headaches. So I originally went to a cardiologist because of the chest pain. I wore a heart monitor for a month. Of course, nothing showed up. I was diagnosed with anxiety, and then the cardiologist thought that maybe ordering an MRI would be a good idea because I had some neurological symptoms as well. So then, of course, obviously the anxiety diagnosis was stripped away when they found the brain tumor on the MRI. And the brain tumor was originally diagnosed as an astrocytoma, and we were told that it was about the size of a thumbnail and that it was in my left frontal lobe. So we controlled the symptoms with anti-seizure medication called Keppra, and that worked pretty well, steadily increasing it from, I think I started that in 2008, and I'm still on it now. And by my freshman year, 2 years later, the symptoms were down to about like a couple times a month or so, I think, and that was a lot better from the 2007 being like almost every day of the week having some sort of symptom. So the symptoms were diagnosed as many focal point seizures, and when I got to high school, so freshman year, they had sort of started to be controlled by the anti-seizure medication, and then my sophomore year, I re-injured my back. I had a really bad back injury at the end of my freshman year. So we sort of put my brain tumor, seizure, neurological symptoms aside and focused on the back. So most of my sophomore year was physical therapy and having back surgery and all that. So then my junior year, this past year, we sort of went back into looking at the brain tumor and doing more testing and stuff. And about 2 months ago, on June 25th, I would say, was when I was told that my brain tumor had grown, that it was not in my left temporal lobe, but it was actually in my insular region, which is between your frontal and temporal lobes, I think, and that it was about the size of a dried apricot, which is pretty big. It's about this big compared to the size of a thumbnail. And we were told that we needed to start treatment. So in the weeks leading up to that, my first day of summer after my junior year, I spent that in the hospital, and I did a PET scan, and that showed, I think actually that first scan was a 3D MRI, and we got a call saying that, no, we did the PET scan first, and then we got a call saying that the surgeon needed a 3D MRI prior to any type of surgery that he was going to perform. And we had no idea that the tumor had grown or that I needed surgery or anything at that point in time. So this nurse is calling us, and she's saying, yeah, like, you need to do the scan before surgery. And we're sitting there like, surgery? Like, what are you talking about? What surgery? So then we went in and did the 3D MRI, and we sat down with the doctor on the 25th, and that's when he told us what was going on. So I think we were all pretty shocked, because I sort of assumed that because my symptoms were for the most part going away, that or that they weren't increasing, that everything was all right. And when we found out that we needed to do something, I mean, I was ready to take action, but we were definitely in shock for a couple days. I think because I was originally diagnosed in 2007, I had built up an entire network of friends and doctors and support systems and resources. So I'd been doing the research for 5 years, so I knew where to go, who to talk to, what to do. So a friend connected me with someone at Johns Hopkins, who went out there, And the doctor at Johns Hopkins actually told us, like, it's not a big deal, don't worry about it. You don't have to do anything about it. And that came as quite a surprise because that was just like a week or two after we had been told basically like you have brain cancer. So then we wrote to the Mayo Clinic. The head of neurosurgery there said definitely needed to operate or do some sort of radiation or chemo. We went out to MD Anderson in Houston, Texas recently, and they told us that we were hoping to use the proton beam there, and they said that we'd have to do some sort of biopsy first, but because of how deep the tumor is, the biopsy would basically be like a surgery anyway, so they'd be doing surgery. So then it came down to, well, not what do we do, but where do we do it? And we also, I had found a doctor at the University of California, San Francisco, that everybody who I talked to loved, and everyone had amazing results from him. So we conference called him. We also saw a doctor in Michigan. So we really shopped around before we had decided on anything. And then yesterday we decided that I'm going to do surgery at the University of California, San Francisco. So I'll be doing a craniotomy to remove this dried apricot-sized tumor in my insular region. So that's somewhere over here. So I'll likely have a nice horseshoe scar to go with that. So prior to surgery, I'll be getting a mohawk. So that's one of the only pluses really out of